Of course, with all this new information, many of you have questions about the measles outbreak, especially now that it's a lot closer to home. So we took a look at some of those top questions North Texas have been currently searching. Our Don White spent the day getting those answers for us and talking to experts. And so, Don, walk us through what you've learned so far.
Amelia, this afternoon I met with Dr. Jeffrey Kahn. He is the chief of infectious disease at Children's Health in Dallas. He calls the death a preventable tragedy and believes the number of cases are going to increase. I asked the doctor the top questions about measles on Google. The #1 Google question is, are measles deadly? Dr. Kahn says about 1 to 2% of children have consequences from the measles, such as ear and throat infections. Some kids can develop pneumonia, and in rare cases, the brain may swell.
I think the fact that we have one death already in just 124 cases really points to the fact that these types of serious illnesses and even deaths occur in measles outbreaks. And we got to make this as a priority, not to take this lightly, even though most of the children who get measles will eventually recover. But
your second top question on Google is, how do measles spread? The doctor says it's mainly an airborne virus.
Measles spreads by contact with somebody who has measles, and the measles is spread through respiratory secretions or droplets. It is the most contagious infection or virus that we know of. If you put 100 people in a room who are not immune to measles and one person enters that room, at least 90% of those people are going to get infected with measles.
And just a few hours ago, we learned about the first case of measles confirmed in North Texas. That's an adult in Rockwall County. I asked the doctor, how widespread could measles become in North Texas?
We don't know how widespread this is going to be, and hopefully public health interventions, mass vaccinations, and case tracking will help us control this current outbreak. But I would not be surprised if we start seeing cases throughout the state of Texas and beyond.
The doctor urges parents to get their children their measles vaccinations, and that typically starts around 12 to 15 months of age. Live in the newsroom, Don White, CBS News, Texas.